brushing your teeth will cover the cheek side, the tongue side, and the biting surfaces of your teeth. However, a large surface area of your teeth does not get cleaned with brushing, and this is the surface that is in between your teeth, or the contact area. Even if it doesn't feel like there's anything stuck between your teeth, bacteria will stick to this area and cause damage to the teeth and the gums, resulting in gum disease and cavities. One of the ways to clean this area is to use dental floss daily. There are various types of dental flosses available, and I would encourage you to have a go at trying them all out and finding one that is best for you. In this video, I will demonstrate how to use a regular floss and a flosser. So you will need about 45 centimeters of floss, and then you'll wrap it around your index fingers until you have about 5 centimeters in between. You will use your thumbs for the lower teeth to control the pressure, and your middle fingers for the upper teeth. When placing the floss between your teeth, you want to use a very gentle rocking motion. That is because this pink area, the little triangles in between your teeth, is called the papilla. And if you put too much pressure on it, it will cut and cause damage to it. So you want to be very gentle. So for the bottom teeth, you'll wrap your floss around, and then you'll very gently rock it into the space in between your teeth. Then you will curl the floss up around one side of the tooth in a C shape and move it very gently up and down. This sweeps up the plaque from the space between the gum and the tooth. Then you take this floss out by scraping it up the tooth in a C shape. You can give this a rinse under the tap, or you can move it along by unwinding one finger and winding the other. Then you'll go back into the same space and do it again up against the other tooth. So I'll just show you that technique again in a bit of a close-up. So I'm just going right in between the contacts, very gently rocking it down to one side of the papilla, as far as it goes down, but I'm not forcing it down, just until I feel a bit of a resistance, and up against the tooth. I'm curling it into a C shape and just gently moving it up and down. Then, as I'm taking it out, I'm just moving it up against that tooth. Then I'm going to go back into that same space, and I'm going to go up against the tooth next to it. And again, same thing, scraping it up and down and up the top. You may find it easier to use a flosser, especially in between the very back teeth. The technique is very similar on how you'd use floss. All you need to do is just place it in between the teeth and very gently rock it down. Then you go on one side of the papilla again, up against the side of the tooth, as far as it goes until you feel resistance without using much force. Again, curl it in a C shape and a gentle movement up and down. You can also move it around just to make sure you're getting all of the angles. Then you can take this out, give it a rinse, go back down the same space up against the tooth next to it, and then same again, gentle rocking up and down, and scrape it up against that tooth and give that a rinse. Once you've cleaned in between all of your teeth, you can then dispose of this.